part 2 of our lesson on inflammation, immunity, and infection. Let's look at some of the things we'll be learning in this lesson. First, by the end of this lecture, you guys will be able to describe how inflammatory changes act as defense mechanisms in the body. You'll be able to identify different signs and symptoms of inflammation. You'll be able to talk about the process of repair and healing of tissue. You'll be able to tell the difference between infection and inflammation, and you'll be able to talk about the actions of commonly found infectious agents in the body. Our other goals for this lesson include being able to describe the ways that infections are transmitted, different ways of that, identifying different signs and symptoms of infection, be able to compare community-acquired infections versus healthcare-associated infections. And finally, you're going to be able to discuss the nursing care of different patients with different types of infections. So, the inflammatory process is the process that the body goes through as a response to injury or to infection. It's a whole series of cellular changes. So, inflammation can be caused by a bunch of different things. It can be caused by physical agents like sunburn can cause inflammation, or x-rays. It can be caused by chemical stimuli, chemical damages, like insect venom, bee stings, chemical damage to tissue. It can be caused by biologic agents, so infection by bacteria or viruses. Any of these things can start the inflammatory process going. And inflammation, literally, it means the fire within. That's where the term comes from. And that phrase really illustrates the 5 main things that happen with inflammation. And those 5 things are rubor or redness, calor or heat, tumor or swelling, dolor or pain, and loss of function. And we've all experienced, maybe a bee sting or some kind of, fall and scraped our knee and experienced these things that happen. The area turns red, it feels kind of hot, it swells up a little bit, it hurts, and we might not want to move that arm or that leg for a while because it doesn't feel good. So there's several different actions that come together in the inflammatory process. So first, what happens is when there's some kind of damage to tissue, an infection, whatever it might be causing inflammation, first there's hemodynamic changes. So what happens is the capillaries in that area dilate so that more blood can be brought to the area. So then from there, those capillaries increase in permeability. They allow more fluid out of them. So what happens here is this allows leukocytes, white blood cells, to get out of the capillaries and into the area that's injured or infected. So from there, they carry out the immune process we talked about in part 1 of our lecture. They ingest and they carry away the bacteria or any of the foreign substances that are in that area. Those changes in the capillaries are caused by certain chemical mediators. So, the capillaries dilate, bring more blood there, they become more permeable, and this all happens because of the release of different chemicals like prostaglandins, histamine, leukotrienes, and then there's also cytokines and eicosanoids, and those in particular are what cause the blood and the blood vessel changes in those areas. The kinin system in the body also contributes to inflammation. The kinin system produces bradykinin, which is another chemical that helps to mediate blood vessel dilation and permeability. It produces pain, which is another classic sign of inflammation as well. And then we have the complement system. The complement system in the body is a series of proteins that enhance the inflammatory process and also the immune response. Now, the complement system is especially important in immunologically mediated reactions, those reactions involving those antigen-antibody complexes that we talked about earlier. The complement system helps to get those going and keep them moving along. So let's review the different steps of inflammation. So first, There are cardiovascular changes to the blood vessels in particular. They dilate to bring more blood to the area. Then the capillaries become more permeable to let blood and fluids and white blood cells out into the area. And chemicals help to mediate this whole process. Okay, so first that happens, but then the next step in the inflammation process is anti-inflammation, where the body steps in to help prevent this inflammation process from getting out of hand, to help prevent it from getting too bad. So cortisol is an important hormone that's released in this anti-inflammation process. It's produced by the adrenal cortex, and what it is it's an anti-inflammatory substance. It slows the release of histamine, it stabilizes lysosomal membranes, and it prevents the influx of more leukocytes. So it impedes the inflammatory process. So the body got it started, and then it releases cortisol after it decides that there's been enough inflammation. It releases cortisol to help slow it down again. So it protects the body from excessive inflammation or prolonged inflammation. And then we also have drugs like corticosteroids that mimic cortisol in the body. And we often use these to treat inflammatory conditions if they're out of hand. Some of the signs and symptoms that we'll see with inflammation vary depending on if it's just localized inflammation or if it's systemic inflammation. So, for local inflammation, you're going to see the classic signs we talked about: heat, swelling, redness, pain, and then all of that together can make it hard to use to function in that particular area. But then, if we have inflammation that is spreading systemically, it's going to present a little bit differently. There's going to be fever often, there might be headache, muscle aches, chills, sweating, and leukocytosis. So, those are the types of things you think about with, for example, infection. If you're feeling sick, that's the symptoms of systemic inflammation. So, when inflammation is being caused by a wound, by tissue damage, tissue repair and regeneration of that tissue is set in motion right from the beginning of that inflammatory process. And the process is going to go more quickly or slowly depending on a lot of different factors. It depends on the type of tissue that was injured, the how bad the wound is, if there's infection or not. If the area gets infected, it is going to heal much more slowly and the infection will need to be treated. It also depends on just how healthy the person is that got injured. So, when there is some kind of injury, whether it be from trauma, whether it be from surgery, first what happens is the body forms a scab in the area, which is made mostly of dried blood cells and fibroblasts. And then fibroblasts come into the area in greater numbers and form granulation tissue. So you might have seen this like when you were a kid, if you scraped your knee or something, and that kind of grainy tissue starts to form in the area. That's granulation tissue. It's one of the first steps of healing the wound. And then from there, epithelial tissue comes in and kind of fills in more over that granulation tissue, both under and above the scab, until the scab is ready to fall off and there's new tissue there. Now, depending on the tissue that was injured or how bad the injury, sometimes the new tissue might not be able to form as well as in other cases. And in those cases, connective tissue may need to come in and rebuild the area, and that will result in a scar. Let's differentiate between inflammation that we've been talking about and infection. So, infection is invasion by microorganisms. Okay, it's multiplication of those organisms that then causes tissue damage. But inflammation is just a non-specific body reaction to tissue injury. So, inflammation is how the body responds to tissue injury, whether that be from a wound or trauma or if it's from infection. Okay. Whereas infection is a specific process that causes tissue injury. Okay. So, infection causes injury, inflammation is a response to the injury. So infection always results in inflammation, but inflammation could be caused by other processes, not just infection. It can be caused by trauma, surgery, other things like that that damage tissue. And inflammation precedes infection. So if there's a wound that has inflammation in the area and then bacteria get into the wound, then infection comes later. Or if there's a little bit of bacteria that maybe gets into the body, inflammation is going to come first before the bacteria proliferates and causes a full-blown infection. And infection usually is the result of invasion by organisms, and it can be caused by a whole variety of microorganisms. There are several different types of infectious agents. So let's go through some of them and talk about different characteristics. So, first we have bacteria. Bacteria are small one celled microorganisms, and they can multiply really rapidly once they get inside a host. And they can have a whole bunch of different shapes and different features to them. Some of them thrive in the presence of oxygen, some of them thrive without oxygen. An important thing that we look at with certain bacteria are what we call if they're gram positive or gram negative. And all this refers to is their ability to take up a stain called a gram stain. And this test helps us to determine if a bacteria is susceptible to certain antibiotics or versus others. Then let's see, a common bacterial infection you might be aware of is strep throat, among many others. So let's look at viruses. Viruses are super, super small microorganisms. You can't see them with a normal microscope. They have to be seen with electron microscopy. And what they are is they contain a strand of either RNA or DNA, and they can't replicate until they're inside of cells of other organisms. They can't do it on their own. So some common examples would be colds, measles, chickenpox, a bunch of the hepatitises, all of those. Zika virus, and Zika is one, along with other viruses that can also cause issues for a fetus if a pregnant woman contracts the virus. HIV is another example of a virus. And because viruses can't replicate on their own, it's really impossible to kill a virus without harming the cells of the host because they become so intertwined. So that's why vaccines are most effective against viruses, preventing getting the virus in the first place. There are some antiviral drugs. They generally don't cure a virus, though. They may help to make symptoms less severe, is usually the most they can do. Then there's fungi, and fungi are like vegetable-like organisms, and they exist by feeding on organic matter. So, think mushrooms and molds, stuff like that. Most of them aren't dangerous, but, some are. Most of the ones that cause harm are, superficial skin infections. So things like ringworm, athlete's foot, stuff like that. But there are some systemic fungal infections that can happen, and when they do, they can be life-threatening. So there are drugs to treat those as well. Then there's protozoa, and protozoa is just another type of one-celled organisms. And ones that produce disease in humans there's malaria, there's dysentery, there's giardiasis, and sleeping sickness. Now, protozoa are commonly spread by food or water that's contaminated by feces. So, food preparers not practicing good hand hygiene or contaminated water sources. And pneumocystic pneumonia is another example of a protozoa-caused illness. Then there's rickettsia, and rickettsia are kind of in between size between bacteria and viruses. And they also can be a bunch of different shapes. There's rods, varied shapes. And what happens is rickettsia, they multiply within vectors. So animal hosts multiply within rats and squirrels. And then they're transmitted to humans by flea bites, mites, lice, tick bites, things like that. So some examples of rickettsia are Rocky Mountain spotted fever and typhus. Those are some examples of rickettsia-caused illnesses. Then there's helminths, and that's just another fancy word for worms. They're parasitic worms. And like rickettsia, like protozoa, helminths are commonly transmitted from hand to mouth by feces. They're transmitted by eggs that are present in feces. Some examples are pinworms, tapeworms, and hookworms. And then finally, there's prions. And prion is actually not living. It's just a type of protein that can trigger normal proteins in the brain to fold abnormally. It doesn't have any RNA or DNA, but it only reproduces by hijacking the functions of living cells. So sort of like viruses in that respect, except they don't have DNA or RNA like viruses do. And commonly, prions are passed on to humans by infected meat products. The most common one that people have heard of is Creutzfeldt-Jakob disease, or CJD, also known as mad cow disease. It primarily infects cattle, but it has been known to be transmitted to humans. So those are a whole bunch of examples of different agents that can cause infection in the body. When we're looking at infection and trying to prevent infection in our patients, we have to look at the transmission of it, the chain of events that have to happen in order for a person to get infected. And infection is really only possible when certain factors occur in sequence. So first, obviously, there has to be some kind of causative agent, some kind of microorganism that is there to cause infection. And then there also has to be a reservoir. There has to be somewhere where this microorganism can proliferate and then be able to spread. So whether that be in human tissue or animal tissue, whether it be in soil somewhere or in feces, there has to be enough somewhere space for that microorganism to develop to a critical mass so then it can spread. Then there has to be a portal of exit. So maybe someone is not covering their mouth when they cough or sneeze. That's a portal of exit, a place that the microorganism is leaving the body. Or through an open wound and not protecting from an open wound. So then from there has to be a mode of transfer, a way to take the microorganism from that portal of exit to somewhere else. So different modes of transfer are direct. This is an example would be sexually transmitted infections, direct contact with the infective organism and the other person. Indirect, so droplets from coughs or sneezes. Common vehicle, so like airborne transmission, tuberculosis transmitted just on the air, or legionnaires breathing in the same air where that organism exists. Vector is another mode of transfer. Those are things that are transmitted by like bites, for example, mosquito bites, ticks, fleas, things like that. And then fomites. Fomites are objects that are left around that have bacteria or other infective organisms on it. So a great example of this is when our patients leave their used tissues out on their bedside tables and don't put them into their trash. Those are examples of fomites. And then from there has to be a portal of entry somewhere in the new person that this organism can enter. So, I have to be close enough to the other person if they sneeze on me for the droplets to get in. If I'm more than like 3 feet away, they're probably not going to get in. Or if I touch bodily fluids of someone with an infection and I have like an open wound on my hand, or I'm not wearing gloves and I should be, those types of things have a portal of entry for those things to get in. And then finally, there has to be a susceptible host. If there's someone, say, for example, someone that's already had chickenpox, if they're exposed to chickenpox again, they're not going to get it again. They're not susceptible. So all these things have to happen in order for someone to get an infection. So that's why it's important for us to do things in our nursing care that can help to interrupt any of these steps in order to interrupt this chain of infection. Signs and symptoms that we're looking for when a patient has an infection are going to vary, again, based on if it's just a localized infection or if it's generalized. So a localized infection is going to have all the signs of inflammation we talked about earlier, the pain, the swelling, the redness, all of that. And often there's pus in the area as well. And then generalized infections are going to cause pain, they're going to cause fever, just general malaise. Anorexia definitely impacts your desire to eat, and prostration, just not getting up out of bed. When we're talking about infection, there's two main types of infection we're looking at, and these are community acquired infections and then healthcare associated infections. So, with community acquired infections, there's some common examples. Childhood illnesses often proliferate in the fall. Kids all come back to school, they've been out doing things in the summer, and then they are put back together in a classroom with a bunch of people that have been in different places, and childhood illnesses tend to go up in the fall. Other examples are of things that can contribute to community-acquired infections are poverty, low immunization rates, and drug-resistant pathogens. All of these things increase diseases that used to be well controlled. Another example is foodborne illnesses go up in the summer. People are barbecuing, they're not necessarily keeping their meats in the fridge, they're sitting out for too long, it's hot, stuff like that. That increases the cases of foodborne illnesses in the summer. And then other things to keep in mind is that sexually transmitted infections, as well as many other diseases, are reportable. So when we're encountering certain diseases, it's the job of the providers to make sure that they are reported to the proper authorities. Then on the other side of the spectrum, there are healthcare associated infections. So patients in healthcare facilities, like we mentioned earlier, they're more susceptible to infection because they're already weakened because they're there in the hospital or in the nursing home or whatever in the first place. And then there's more drug resistant organisms there for them to be exposed to. Another type of healthcare associated infection is an iatrogenic infection, which is an infection that is caused by the treatment that we give. So, a patient who has an organ transplant and is placed on immunosuppressants so they don't reject that organ, they are often at increased risk for an iatrogenic infection because of those drugs. Or a treatment with broad spectrum antibiotics can then often lead to diarrhea or the proliferation of other diseases because it kills, in addition to killing what the bacteria that needs to be killed, it also kills the proliferation of good bacteria in the area. So it allows bad bacteria that remain, that are not susceptible to that particular drug, it allows them to proliferate and cause a new infection. So let's look at some examples of infections and how they might have been transmitted. So, our first example, we have a patient with a subclavian line, which is a central line, that develops septicemia. So, how might this have happened? Well, it's very likely that bacteria from improper CLABSI technique, and CLABSI stands for central line associated bloodstream infection. Okay, so when someone has a central line, just like with an indwelling catheter, it's important that we are being very cautious and on top of cleaning that central line and making sure that dressing changes are happening appropriately, because that central line, just like it sounds, goes centralized into the circulatory system. So any infection that goes in, it goes systemic. It's a big deal. So our next example, we have a post-operative knee surgery patient that develops a localized infection. How might this have been caused? Probably from bacteria from improper sterile technique for dressing changes. So again, another example of a healthcare associated infection that was probably caused by not doing our due diligence with aseptic technique as we change those dressings. So let's look at now some other examples of community acquired infections. So another example would be a patient who recently visited an underdeveloped country, and this person develops hepatitis A. So this is an example of community acquired infection. It's a virus they got by the fecal oral route. That's usually how Hep A is transmitted. And our final example is a 3-year-old child from South Africa who is new to the United States and develops a severe case of chickenpox. So this is an example of a virus acquired from community acquired infection. A child who did not receive the chickenpox vaccine where they lived comes to the United States and then contracts chickenpox here. When we get a patient with infection, we need to do certain things to care for them. We need to really be urging the patient to consume adequate fluids, because often they do have that sense of anorexia where they don't really want to eat or drink. So they often need encouragement to make sure they're hydrating appropriately. They also need encouragement to consume enough calories, particularly calories from protein, as well as vitamins, because those will all help them to heal and not to deplete the protein stores in the body during the healing process. If a patient is in need of being in isolation because of the particular organism that they have, then we need to make sure that we're complying with all the isolation requirements for that patient. We'll need to make sure that laboratory tests are done, that we're sending off urine samples as needed, blood samples as needed, and that we're following up to check what the results of those tests are so we can anticipate the treatment that will be needed. We need to administer antibiotics in a timely manner as scheduled by the providers. And then in some cases, hyperbaric oxygen therapy is important for infections because this type of therapy, it speeds healing for things like carbon monoxide poisoning, gangrene, stubborn wounds, and just any infections where the tissues are starved for oxygen, because this helps to force more oxygen into the tissue. All right, so let's review a couple questions. First question: the inflammatory process involves 4 changes or factors: hemodynamic changes, increased permeability of membranes, chemical mediators, and what? The answer is D, decreased release of histamine. That's the response that where the body kicks in after starting inflammation and comes in afterwards and says, now it's time to have an anti-inflammatory effect. And question 2, blank are one-celled microorganisms capable of multiplying rapidly within a susceptible host. They are classified by shape, cluster pattern, whether they need oxygen, and their ability to take up and retain stains. So what's our answer? The answer is B, bacteria. Bacteria are the microorganisms classified by whether or not they can take up those gram-positive or negative stains. Okay, one more question here. A 44-year-old man is admitted to the hospital with complications related to HIV infection. What are some signs and symptoms of HIV infection? What types of precautions must a nurse take when working with this patient? So think about it for a second. Okay, so let's talk about HIV. A patient with HIV is immunocompromised. So you're going to see these patients, they're going to be getting sick more frequently. They're going to contract illnesses more frequently. And so it's important for us to put precautions in place for them. Often these patients will need to be in a protective environment where we have airflow going out of their room so no microorganisms are brought into their room from the air. We may need to keep live plants or flowers out of the room so no fungi can grow in those and spread to the patient who is at increased risk for those. Things like that. We also need to have precautions in place for ourselves so we don't come into contact with blood or other bodily secretions, except for sweat. So we would be making sure we wear gloves with these patients. We are going to be cautious about needles around them, things like that. Things that we would do anyway, but we need to be especially cautious that we don't get any kind of blood-to-blood transmission with these patients.